Okay. So, good morning, everyone. Like I said in the announcement, there's not really much planned for today, just Q&A session. I do want to hit a couple of things on what has been updated. I'm going to try and share. So right now in Module 4, we have the comprehensive topics list that Ms. Love went through and copied my portions and added her portions and is now in one document. So this is a Word document, so once you download it, you are able to add to it however you need to. It's not a PDF. You'll notice that throughout, there's some things that are underlined and starred. Those are our hints for studying, where we're kind of focusing on what's the most important things, most common things in children that you need to know about. So that's one thing that has been updated. So that's at the very beginning of Module 4 now. And then you have your weekly sessions. The items for your required learning assignment Module 4 have all been open and updated as well for the past few days. There's questions for cardiovascular, hematology, and cancer with pediatric children. So when you click on those, it brings you to a quiz. You do those portions of your quizzes, and your grade for those is pulled over into the rubric here. So if you make a 90 or above, you get the full marks. This week is respiratory. My lecture is here. It is an hour and 12. It is a little lengthy, but it covers everything in this list, which is a pretty long list, but you'll notice that certain areas that I spend a little more time in, a little more common, I have a little more background on, or stories. These are the focus items. These are the what's most common. If you were to work in pediatrics area, these are what you need to know about, need to know how to educate the family about. Those are the most important ones. I'll update this to reflect because what I do have are questions, but I'm saving that for the NCLEX session that we will host on next Thursday related to respiratory. Oh, when you click on the PowerPoint, on the PowerPoint, on some of these slides, you'll see these little hyperlinks. So discuss this in somewhere along in the, but I'm not signed in. Now I'm signed in. You're able to click on these hyperlinks. If not, I did copy the links into the lecture notes that's here too. So those hyperlinks are also there. I just wanted to make sure y'all had them. So this is a Word document that is copy pasted all of the notes that I'm reading off of, my little tidbit notes and the pictures and the hyperlinks there. So you can click on those again. So this is through PicMonic. There's different things that's going on here. So some of it will be just an assessment. Some of it will be treatment. Some of it will be both. I tried to grab whatever that was as possible on PicMonic. So it kind of goes through, it's not just a picture is kind of a story now. They've kind of upgraded. And so you have, when you create, it's a free account. I'm not going to sign into mine right now, but you can play it. So it plays the scenario about all these different characters, how they're intertwining with the scenario. Kind of helps give you a memory piece to help remember what's going on with the disease process and treatment. And then also at the end, it has a few questions, like a little quiz to see what you remember from the scenario. So I think they're pretty neat. There's a few on most of the topics here. You'll see here. Other specific things don't have them, but most do. I just wanted to bring your attention to those. That's something just to help you remember certain things, remember what's going on with the disease process. So you can kind of compare and contrast, which is kind of what I was hoping you'd be able to figure out when you do your Venn diagrams. That there are some similarities here, but then what's the differences? And like here, bacteriotracheitis is kind of like both. You'll get through my lecture. So you're kind of combining the main concepts differently. Are there any questions about any respiratory disorders at this time? Anything that needs to be addressed? Okay, there was a question asked about, do you need to study all the topics or only the underlined starred ones? I would understand the basics of all of them, but the concept is needed for what's going on with another one. So I don't know. Is this one underlined? Which one's not underlined? That's what I was afraid of, that they wouldn't work in the PowerPoint, but they are the same hyperlinks in that lecture notes. Where am I at? I hate this thing. I wish we could move the banner thing to the side. Because it's just in the way. I'll just go to Canvas again.
There's the list, Miss. If you want to go back up to the beginning, there's the list.
I was just trying to do my list for this. Yeah, so allergic rhinitis is not underlined here, but it's important to know the difference between that and pertussis. What's the more serious one and why is it? So you kind of get the concept and the basic of what's going on with these other drastic ones, acute epiglottitis. It starts as like common cold, then it progresses. Well, allergic rhinitis is the common cold. So you need to know the signs and symptoms of common cold, because that's what it will look like at first with these other ones. But then when it progresses to this more serious thing, this is when the emergency situation kind of comes in. Emergency situations, when that plays that factor. And so I wouldn't say ignore the other ones, but know the basics of these other ones, but then make sure that you know these ones, how to treat them, education for the parent, education for the child. That's where your main focus. I don't see a problem with saying that main focus would be, but don't neglect the other ones.
I was going to add that in addressing that same question, basically what you said, because we can ask you about any of them, but the ones that you because you do want to be familiar with those, you can see any of those at any given time, but the ones that we've underlined and starred our primary focus, just because they may potentially be more common, depending upon the situation, depending upon what it is. But we don't want to tell you, don't look at any of the others or don't study those, because you can be questioned on any of those. And we know it is a lot of information. That's the reason why we sort of highlighted certain ones. If you're going to spend the majority of your time on those. But again, you can be questioned on anything.
And NCLEX too.
Right.
But I feel like
That's what I was referring to.
Might lean more towards these underlined starred ones, how we're trying to also develop this module, but that doesn't mean that the other ones NCLEX is also going to forget about. So.
One thing I want to say really quickly, I was trying to get in to say it earlier. I love your presentations, Ms. Gilbert. If nobody else does, I love your presentations. I love pics because they just help, a lot of times to make this content more understandable. And you've done, I think, an excellent job on your presentations. So I just want to say kudos, because I know the work that it takes. I know how much work it is to do all of that. So great work. And then there was a question from Audrey.
This past week, Lily was home with me again. Poor baby keeps getting sick. And so each slide had to be recorded on their own because of interruptions. And so you might be able to hear me take my big deep breaths and try to calm myself down in between. So y'all, I'm really trying. She also interrupted me. I had to do a recording for my own school project, and I was trying to hurry up. It's only 10 minutes when I recorded it the first time, but she interrupted me, and I was like, just wait 10 more minutes. Stay out here with Daddy. And sure enough, she comes in right at the end of my second time I recorded it. So then I recorded it a third time. She comes in at the very end, and I'm like, oh, well, I'm turning it in. Like, you can't contain her for 10 minutes.
Audrey, did you want to ask your question?
Thank you so much. It was just kind of wordy, so I didn't want to put it in the chat. Okay. I just wanted to get clarity. I've been looking at the rubric for the presentation, and so for the presentation, you're not presenting the media. You are doing just a verbal breakdown of the project. Is that correct?
The media should help with your visual, kind of in the background. So it'll be presented while you're presenting. So it should follow with your presentation.
If we chose to do like a YouTube video, though, or is that just not the best method? Because you know how some of the videos are when you share them on WebEx, they're very laggy and disrupted. So would PowerPoint just be your best go-to there?
Yeah, it needs to be you presenting the topic. So go to the actual rubric. This is just the panel versus Media and presentation. So for the media and the presentation, it's kind of together, but you're going to turn in your media ahead of time just so that we make sure that we have a copy of it and there's not an issue the day of you presenting that you don't have a media, you don't have a presentation or visual aid. So it really could just be a bunch of pictures in the background. And so then you're just talking about it, going through it. And then also, because we can't give you presenter on WebEx, that way we have the PowerPoint or whatever visual aids already printed out in front of us that we'll do over the weekend. And then all you're having to do is worry about your presentation of it, but it will follow along with your media. So
you're not necessarily having it going on in your background. Y'all will already have it up.
Yes, we're going to do it together. It's just to make sure that accidents or the media doesn't upload, or you don't, you're not able to share your PowerPoint the day of. It's going past your 30-minute mark, going into another student's time frame. That way, at least hopefully one hiccup possibility is already knocked out by you turning it in the weekend before. And then that way we can go ahead and make sure that everything is downloadable, everything is, we can print, we can see everything, because sometimes there are issues with documents being uploaded recently. And so we don't want that to be the case on the day of during your 30 minutes. That way we can go ahead and work out those kinks over the weekend before your presentation.
Awesome. And for the Q&A, I was wondering, so, you know, I plan on sitting as much as I can, but say you're up there or sitting there and you get a question and you don't know, if you professionally and confidently tell them, you know, do you lose marks in the other areas if you get a question wrong?
I would say yes and no. So what you're doing is presenting pediatric development, choosing 2 concerns, pregnancy progression, 2 concerns, and then labor and delivery, and then 2 concerns. So you're picking any 2 concerns out of these 3 areas. So 6 concerns that you're going to briefly touch on, just what it is, what it means. And then we're going to ask you the question, okay, so how do you treat that? What would you educate? Why are you educating it that way? We're going to get into those nitty-gritty specifics of those problems. And so choose 2 problems that you're ready for those questions on, that you can answer. Why does this happen? Why would you give this medication? Not just, you're going to treat with magnesium. Well, what's the reason for magnesium? We need to make sure the deep understanding of only 6 items. So choose your 6 that you know the best. So you're only going to get questions over the problems that you are presenting.
Gotcha. And they're not going to be crazy questions like from the expert that we wouldn't be ready for if we knew what we were talking about.
No, someone did ask me that in an email, but we know what you've been given. So if one of the experts does ask you a question that was not presented and we know that you don't understand or don't know that, then that won't be counted against you. But if it is something that has been presented during this class, and it's something that we feel that you should be aware of or know of or been tested over, then of course, if you don't remember that and you chose this topic, then that could be held against you.
Gotcha. Okay. Thank you so much.
Mm-hmm. So then this is just the panel part. So then, I mean, the media part, the panel is based off of your professional communication, presentation skills, and then your demonstration of understanding. So this is where the panel comes in. So if you, we're not going to have a lot of time, and it's only over your 6 problems. So if really, I feel that most of the questions are going to come from our questioning of the layperson on the panel. If they didn't understand something that you presented, and if you started to talk about malpresentation, but you didn't explain that terminology, did that layperson understand everything that you presented to us? And if not, that's where we're going to own in on questions. What do you mean by malpresentation? What presentations could they have been presented in? What do you have to do? That's when we might get a little bit more particular if you don't explain it in your presentation. And if you aren't able to answer a question that we feel that you should, as the instructors, then you'll be marked down from there.
Just one last question on the media. If you tweak it, say you turn it on the 30th, and then you go to really working on your presentation, and you need to tweak your PowerPoint, or you found something cool to add to it, is that like a no-no?
If it's for improvement, I don't see a problem with that, as long as you're able to give it to us by your presentation time so that we still have access to it. So upload it again or email it to us. Make sure that we see it before your time. So don't show up to your time and be like, here, I'm going to send you this. And then we're wasting your presentation time on finding your media. Does that make sense?
Yes, ma'am.
Okay. And to Jamie's question, will you be dinged for going over it? No, none of the rubric is about how long it lasts, that you have to have a minimum or a maximum. But please don't. You guys are all only spaced out 30 minutes apart, so that gives you 15 minutes to present, 15 minutes for the panel to ask you questions and grade your rubric, and then move on to the next student. We are hoping that we don't get behind and that we're doing the rubric at the same time and not having to come back to anything. And then that way, as soon as you're done, your rubric is posted. And then we start with the next student. I'm hoping that it's very quick, very easy process, but because you're only presenting the basics and starting the conversation on 6 problems, and then we'll put in the rest of the conversation for about the treatments, the problems, things like that. So you can go ahead and start signing up for your appointment slots on the calendar. So make sure on December that you have the class checkbox on the right-hand side, and there's presentation slots still available for each day. Monday is getting kind of full. There's still a 2:30 and a 3, and then the rest of the days for Wednesday, Tuesday, and Wednesday. And they're for these specific times. So that is when we're going to go by this. So you're signing up for your own time. What's best for your schedule. Yeah, the paper, Jamie, talks about 24 problems plus a very more, it's still over the surface, but more in detailed assessment of pediatric and maternal. Your presentation is going to be very skim off the surface, very short assessment. So you're going to go through pediatric development. So what are those major milestones? So if your mom coming to this presentation, that you need to be watching for your kid to hit these major milestones during development. And if they don't hit these major milestones, what are 2 potential problems, either developmentally or physically, that they might be a concern for, or that they've caught a communicable disease or something like that. And then do the same thing with pregnancy. 2 problems, minor, the main assessment problems about, you're going to your OBGYN, you're getting prenatal care, you're doing your vitamins, you're doing your folic acid, and then you're doing your kick counts. And then if you don't get kick counts or they're on your ultrasound, baby's measuring small, then there's your 2 problems. And then with labor and delivery, again, your normal assessment, what you expect, and then 2 problems. And then based off of those problems, that's where we'll ask you your questions.
Ms. Gilbert?
Touching on 6 problems. Yes.
Do you mind, can I have like 3 minutes, and you can time me, to sort of give them an example of what we're discussing? I have a presentation. Can you share with me, and then I can, or maybe I can send it to you and you can, just to sort of give them an idea of what
Sure.
we're referring to. I was trying to find my presentation. I found it.
Okay.
All right. I'll be quick. So and Ms. Gilbert probably will be able, have to do this as well. For my master's program, at the end, I had to basically prove that I had met all of the competencies of the program.
Yes.
Mm-hmm.
I've already started.
So we basically, exactly what you all are going to do, we had to do it, and I'm sure that's where she got the idea. Because this is exactly what you'll do in a master's program. But it even though I know, first of all, someone might say, well, we're just an associate's. Promise you that other associate's programs do things like this too. So we're certainly not giving you anything that is specific to CGTC. But if you all can see this presentation. Yeah. Okay, so basically what I had to do, and what, again, Ms. Gilbert would do, is we had to write a paper, but what we did was we had to turn that paper into a presentation. And so there were specific competencies or specific guidelines and a rubric, just like you all have given a rubric. And so what you do is you provide the information from your paper. And I would recommend, you can do what you want. I recommend that you use a slide presentation. Reason for that is you can have your notes at the bottom. And you can, it's very easy to just insert pictures and things like this. So in this presentation, I had to prove like this was from a specific class. And so for you all, if your condition is, I don't know, bronchitis, then you can use your notes, pull some of the pertinent information that you have gathered on bronchitis, put it into your, put it into your own words, but then use some type of visual. And so even though in your paper you may have, so in this class, this was this presentation these specific pictures that I'm pointing to, that was for that one class. And it was a paper that I had to write, as well as, again, I had to make a presentation. So if this were bronchitis, you would say some things about bronchitis, just hit the highlights about it. So you're not going to put everything that you've written about bronchitis on the slide, but you're just going to hit the highlights. What is bronchitis? Who's at risk for it? What are the manifestations of it? Those types of things. And how would you address it? And then what would be your outcomes for someone who has bronchitis? And then use some type of visual to support that. So that's basically what you're going to do in this presentation. You're not going to write out everything, and you're not going to talk about everything that you've written about. You're just going to hit the highlights. So when this was at the top of each one of these things, I had to address the competencies for the program. And so as you see here, this is just a visual of how I met this particular competency. But what I did with this was, I had to talk about whatever theory this was, but I discussed it. So I just used this slide, and then I discussed how I incorporated that into my teaching, how I incorporated that into meeting the requirements for that course. Okay, so you all, I recommend that you focus on something that you feel comfortable with. You know, if bacterial tracheitis, or let's say one of the congenital heart disease disorders, which can be difficult, if that's not your forte, if that's not something that you feel really strongly in, don't choose it. You have, and that's the beauty of it. You have, see, we are not really given the option. We are told, these are the competencies and this is the rubric, and you need to meet our requirements. But you all
We're
have,
you pick 6 of your own competencies,
right,
feel the best about to present.
right. Now, one thing I do want to encourage you all is to make sure that you provide the resources that you use. So you'll see, like here, you want to make sure that if you have a, if you get something from Wikipedia, which I hope you don't, but that's your decision, make sure that you provide at the end of your slide, at the end of your presentation, now and always, that you provide your references. That's very important in academic presentations. You always want to make sure you have to use credible sources. Yes. Again, we don't want to. So this is where this was. Again, I want to speed up because I know I don't want to take your time, Ms. Gilbert. But this was my putting it all together. So this is what Ms. Gilbert was referring to. For my presentation, my assignment, each one of these things was one of the requirements. One of the I can't think of the word, Ms. Gilbert. One of the requirements for the competencies, excuse me. Each one of these, evaluation was a competency, curriculum development was a competency. So these were courses and competencies that I had to complete. And so basically, once I discussed how I met all of those, then I provided a slide that said questions, because I knew that I was, and so there was a panel of professors who asked me questions about these things after I did all of that talking, and I think it was like 15, 20 minutes, and discussed my slides. Then they asked questions about them. And so what that means is that I did not wait until that morning to prepare for those questions. You never know what you're going to be asked. But what I did was I reviewed my content. And, if you think about it, one of the things that professor told me once is that when you're doing a presentation, you are the expert. If you think about it, you are the expert because that's your content. So again, if you are presenting on bronchitis, you are the expert on bronchitis at that point. And it's easy. And again, having been in this position that you all are going to be in, I know the first thing you're going to think is they're going to find like the most specific, minute question, most ridiculous question on the planet to ask me about bronchitis. But I promise you that's not the case. And one thing I had to learn myself is that your faculty actually want you to be successful. Right. So we're not going to pull some minute detail from somewhere in this thick book to trip you up. That is not the goal. We want to know that you know what bronchitis is. We want to know that you know how to care for a client who has bronchitis. We want to know that you can provide patient, client, whatever you want to say, education on how to prevent, how to recognize, and how to treat, and how to prevent the complications of bronchitis. That's what we're looking for. We're not looking for minute details that only someone who had read this whole chapter would know. I hope that's helpful. That's what we're looking for. And again, we're not looking for perfection. We do want you all to show some, be professional. We want to see that you put effort into it, but it's not a matter of PowerPoints are my thing. Obviously, you all can see this, but think about how many PowerPoints I had to do to get to this point. And so we don't expect you all to be on the level where we are. Hopefully you all will get to that. as you continue your education and continue to do these types of things. But that's not our expectation by any, stretch of the imagination. We want you all to be successful. Okay, I'm done. Thank you, Miss Gilbert. I'm trying to.
Good, thank you.
I'm trying to
So yeah,
get
the
back to
media
it.
should just help
How do I find it?
to your presentation. It's not a different presentation on its own. It's just visual cues for you. Ideally, in regular normal world, you would be presenting these to us in the classroom, and so this would be on the projector behind you. So think of it that way. But there's not really a way to be you projecting something. I can share with the group, once you've shared with me the original document, I can share through WebEx so that the other panel of people that's joining us can follow along with the presentation while you're presenting. And so that's just so I'm going to be the presenter of your document. And we just need to make sure that that works ahead of the 3 days back to back for you guys. That's the only purpose of it being turned in just slightly earlier. So it doesn't even have to have any words on it if you just want to do pictures. Whatever is going to be visually helpful to your presentation, adds to your presentation. You can have your own presenter notes, note cards or anything in front of you. Of course, not your textbook. So if we ask you a question, you can't go to your textbook, but you can have your notes with you. You can tell me when to go to the next slide. I should be able to figure it out if I'm paying attention, right? So, but yeah, if you want to give me those cues, that would be helpful too, but you don't have to. Because again, this is not your fault that we're doing it this way. So we don't want that to hinder you. We want you to just do what you are there to do, and that's to present on the topics. And I don't want you to be focused or worried about anything else. I'm going to be there to try and help and support you. So some of the people that are going to be on the panel are Sam Lester. He's professional development instructor. He's going to be there most of the days and times. Miss Frida Wimsat and Miss McBurse. She is the other maternity kind of expert. Her field of nursing was in the maternal world. She is an instructor for the LPN program. So they're the kind of two experts. And then you have me and Miss Love, and Miss Wilcox will be joining in periodically. Miss Rivers and Miss Hunter will be in back and forth. I mean, I know y'all have that exam the first day, so don't expect them to be there the entire time for the first day. And then we also have invited some other guests. I'm waiting on their responses. So we'll see who else is coming from upper management. They love to see how the nursing program is going and doing. But I don't want the presence of certain people to make y'all more nervous. This is just to have a clear panel of people to make sure that education is being done.
And again,
we'll see them, and will all of you see us. It depends. Depends on the person. We're all going to be through WebEx on our own different accounts. I'm going to have my video on at the beginning, and then some of the other instructors might as well. It just depends on if they have access to camera wherever they are. But I'm going to promote that the most of us as possible have our cameras on so that it is like we are sitting in front of you, because that's the purpose of a panel, right? So that our presence is in the room with you and not presenting to a laptop. And your camera should be on so that we can see you and follow your presentation cues.
And this helps to prepare you all for the jobs. Most
job interviews.
Nursing interviews are panel interviews now.
Every one of them that I've ever been to.
In the most recent years, mine have been panel. prior to, I don't know, originally it wasn't, but I started in 96 too. So, so it's been a while, but over the years, it certainly evolved to a panel, and that can be a little concerning. So I think it's a great idea that Miss Gilbert chose to do this way. There's multiple benefits to this. I know you all may, from your perspective, you're like, just give us an exam, but I promise you there are multiple benefits. And at a later time, as what usually happens, you all will thank her for this idea.
And I'm hoping it's actually not as stressful because you only need to know 6 things, but you do have to present, you do have to be in front of a panel, which that I'm hoping will help you not only for a leadership course next semester, but yeah, when you go for interviews. In my experience, the panel interviews are at least 4 nurses of different managerial experience that may potentially be your coworkers at that time. I've had a panel up to 8 people on it before, which was quite intimidating. But in that experience, they all seem to have similar type questions, and it's just dividing the questions among the panel. And so then you have to focus your question towards that person, but then also to the group. And so then you start small and then you get bigger. And so you start with how your experience answers that question and then why that experience matters broadly. And so that's how I've always done those panel interviews. And so far, I've always gotten a job offer. So try not to think of it as so many people. So I like to focus on the one person who's asking me that question. And then, so I'm kind of like, I have blinders on, like a horse with blinders. So I'm only focusing on this one person during this one question. And then as soon as I've finished answering the question, then I back up and then I see the whole panel and then I readdress the whole panel again. Extra mini semester just for this project. I think you guys are going to be fine. Okay. I know you're going to feel like you're putting a lot of time and effort into this project, and we love to see effort, but I'm hoping that this is very beneficial to you guys. So instead of having a final and having to memorize and retouch on everything from the beginning, and then the final being a little bit more nitpicky on those specifics, we won't have to be nitpicky about specifics. And instead of 50 bajillion topics, it's only 6 topics and it's of your choosing. So try and stay on the positive side of that. Pick 6 topics and just study those 6 topics for the next odd weeks, 3-4 weeks. And remember, you can have your notes with you. So if you want to write them all on note cards, your papers that are there, that's for the presentation. Don't have your entire notebook from the entire semester having to flip between your different disorders. Yeah. And remember your presence. If your presence is, you're carrying some confidence, I may not know that you're secretly terrified inside and tripping up. If, so you can actually fake it till you make it in a lot of these areas. So you're the expert. Try and fill that shoes, okay, when you're presenting. Just let it come over you that you're presenting, that you're almost there. You're almost a nurse. You only have 1 semester after this. This is your last thing before your last semester. So kind of get that air of confidence on you when you're presenting, okay? Especially those of you that want to go into this field. This should be your time to shine, okay? Trust. Yes, trust. Also, make sure little to no distractions are occurring in your background if you have to go somewhere away from the children during that period of time. Might be helpful. I'm actually surprised Lily has stayed in the bedroom this entire time. Usually she doesn't make it 10 minutes. So you never know. No, just in general. I just thought about, I heard PJ Masks on the TV screaming again. So I just remembered Lily. She hasn't come out in a while. It just reminded me about distractions. Yeah, it's probably time to go check on her. I am home alone with her again. Poor baby just keeps getting sick, not feeling good. Went to the doctor again over the weekend, but it's not pneumonia. So we're at home again. No, she's very slow and lethargic. She's not feeling good this time, so I doubt she's made it out of the bed. All right. Well, you can always reach out to me or Miss Love about any further questions that you may have about the lecture topics and about the project. That's really more where I wanted to spend most of today, was just talking about the project. So I'm glad that Audrey started with her questions, just because I know there have been a lot of questions and we're getting a little bit closer to it. I did send out an email. I was hoping to curb some anxiety about that. Yeah, continue to ask questions, to seek any clarification as needed. That way this can go smoothly as possible and have as less stress to you guys as possible. Because I know y'all have got a lot going on in the other class as well. So we've got one test left, and then we have this presentation, and y'all are almost there. And that's why I've had a lot of questions recently. And so that's why I was like, even though I've sent out emails, I just, maybe this is a little bit more informal, but also formal. I don't know, but it addresses it to everyone so that any questions can be addressed at the same time. And that way, like in your case, you said that you didn't know you had those questions till she asked them. So that was why I wanted to do it all together. There also is a discussion board about the project. There's only a few things on there right now, but as we get closer, I'm sure there'll be more questions popping up, and I'll be sure to make sure that I check that, excuse me, as often as possible. And I will be, so semi-announcement. Y'all know I taught pharmacology for you guys, which means the new group that's coming in, I'm teaching pharmacology again for them. So this will likely be the last time I'm with you guys. So I'll be going to the new cohort. Of course, I'll be around on campus, and you can always reach out, but formally as part of a class, I don't think I'm going to be part of your classes for next semester at this point. I do not know who's teaching any of the courses on y'all's side yet. We have the new students coming in next Friday, so that's where we're trying to get everything settled for the new group, because they're going to hit before you guys hit. So I do know I am doing pharmacology, and Miss Wyvers is doing foundations again. So that leaves Miss Hunter and Miss Love to do the other two courses. I'm not sure how they're splitting that up yet officially or not. I know we have had meetings, there have been discussions, but nothing has been official yet. So once that has been official, we'll let you guys know. Just take pharmacology again. I wish. Also, I I was going to send out an email, but I'll just go ahead and ask you guys if y'all want to send me an email about what was great about pharmacology, kind of like a little evaluation, what was great, what was not the great, wish that you had more time, wish that we spent more time on this, anything that could help me with setting up pharmacology again, that would be helpful. I'm working on making the labs a little bit longer because I know we did a lot in a short period of time on each one of those labs, so that there's more time to do each thing. But I also know we were kicked out soon, so we didn't get a whole lot of time to finish the labs that I had planned. But anything that y'all can think back on during those times that you thought was great and don't change, or things that might probably be doing better, that could have done better. Okay, Miss Love says that Love is doing leadership. I didn't know if y'all had met yet, because I know that y'all are going to have another meeting.
We discussed it on yesterday, and I actually thought about.
I didn't know when y'all were meeting.
Yeah, we had a discussion on yesterday, and I thought about just honestly from everybody's standpoint, but especially from, I think about, students that just basically trying to provide some continuity for you all getting ready to graduate. I think that'll be beneficial to you all.
So then Hunter will do the majority of Health and Illness 3, and you'll have a section.
I think so, but I know she's going to do all of leadership. We discussed it after. I called her after class. I see someone said she told them yesterday, so I called her after her class. Hunter told them that she's teaching leadership. Right. So that's after class. So right. We met after. Okay. And it works out for everyone so that she doesn't have to create a new class. I won't have to create a new class, and then there's that continuity for them. Yeah. So I think that that's beneficial to everyone. Right. Did you taught some of leadership last time, didn't you? Yes, I taught leadership. I taught the entire class. Ms. Wilcox did the graduation part of it, as far as like the ATI, comprehensive, all of that, but I taught the class. Okay. I am being summoned. So let me know if you guys need anything. Send me an email. I'm going to head out because she is screaming my name. All right. I'm coming. Before you leave, Miss Gilbert, are there any questions about the cardiac content? Anybody have any questions before, anything that needs to be clarified before we leave, since this is an opportunity we have? Going once, going twice. Right. Any questions over the week? I don't know what, 12 last week, cardiac. How in the world does the blood go in and out of the right atrium? Am I understanding the question correctly? Ms. Gilbert, can you make me presenter, if you don't mind, if you're still there? Okay, and I can't share with you. So blood enters the right. Are you talking about the flow in oxygenated and deoxygenated? So deoxygenated blood, if you just think about the normal, just say A&P, the normal flow. So deoxygenated comes from the feet, basically, from the feet back up the legs and all that, through the liver, all of that. But basically it returns from the bottom of the body through the IVC, inferior vena cava. And then it returns from the head through the superior vena cava, and they both enter the right atrium. Is that what you mean? So that's where your deoxygenated blood comes in. So you should not, under normal circumstances, blood on the right side of the heart should be deoxygenated, because you've got your IVC and your SVC that empty, and those are deoxygenated. That's deoxygenated blood. And so they enter back into the right atrium, and then from the right atrium, they go through your tricuspid to your right ventricle. And so that blood is deoxygenated. So that's the normal process. So if you have oxygenated blood on the right side of the heart, that means that there is some type of abnormal opening that's wherein blood from oxygenated blood that has already come from the lungs, and it should be on the left side, that blood has mixed over. It's shunting right. That blood has shunted over to the right side. And so that's going to be some type of abnormal opening. So that's usually where you see your atrial septal defect or ventricular septal defect or something like that. There's some abnormal opening that allows blood from the left side is oxygenated, to shunt over to the right side. So that's how you can have oxygenated and deoxygenated blood. And so you have to think about, in all of those different conditions, there may be a lessened amount of blood that is circulating, but you still have circulating blood. So even though we say that blood is oxygenated or deoxygenated, there's still some level of oxygenation. It's just that when you have your right side that is predominant, then you're going to have a greater percentage of deoxygenated circulating blood. So the blood that's leaving the left ventricle that's going to the body, that is going to be a greater percentage of deoxygenated blood when there's problems on that right side. Now, the only time you have where blood is not circulating, that's going to be your tricuspid atresia. Remember, because there is no tricuspid valve. So there's no way for blood to get from the right atria to the right ventricle. So that baby's going to die basically very quickly if it's not recognized and treated. There has to be some opening. I hope that answers your question. Or tell me if it answers your question, rather. Oh, wait, it says I can grab the ball to become presenter. Yay, look at that. Now I can show you a picture. Did that answer your question, Wood? Hello? Oh, okay. Okay. I was like, did something happen and I missed it? Are there any other questions? I am, for the next week's content, I'm working on a study guide. So I hope to have that completed in the next day or so for the next set of content. But we do have the topics already posted. So I hope to have a study guide very shortly. So my plan is to get the study guide out and then work on that feedback. So hopefully by Friday, that's the goal.
My goal is to be done with the maternal feedback today, and then tomorrow get as much as possible done on the problems one that was just submitted, because I haven't even finished the maternal one in my section yet.
I am able to work in my office here on campus, and I am back in full swing, and I love it. I'm so grateful to be in this office. So I'm getting a lot of work done, so it shouldn't be that much longer. I want to try to come every day that I can. I can't get this work done at home. There's too many distractions for me. But in the office, you can focus. So should be able to give you all some feedback soon and be caught up on all the things that we said we were going to do soon. I am very grateful for my office. When we were forced to be on campus prior to COVID, I was like, I wish we could work from home. I would love to work from home. I was wrong. Yeah, it is. It's hard for me too, even though I've been an online student since 2000, early 2000 something. I did my bachelor's and my master's online. But for some reason, it's just much more difficult now with this COVID issue. Like that just made it worse. And just some transparency just to share, because I am not ashamed of this. I'm actually very happy. I had testing done during September and October, and I learned that I have adult ADHD. Yes. And I'm sure I've had it well, you don't develop it as an adult, but I've had it all my life. I just didn't know it. And I was very happy to learn that all of the things that I thought were character flaws about myself were not character flaws. They are actually clinical manifestations, and I just never knew it. And I'm not excited about, hey, I have ADHD, but I'm actually excited because now that I understand that it's not just me, all these things that I struggled with for so long. Now I know that this is something that I can change about myself, as far as there's treatment, there's cognitive behavioral therapy, of course, medications, but there's options now that actually helps. I'm able to make some changes, and that makes me very happy because I want to be able to do, the best that I can. Yeah, a meaning for the madness. So, one is medication. I actually enlisted the help of what's called an ADHD coach, and I'm still waiting to sort of get that going. I had an intake evaluation, but I am seeing a counselor, and actually I'm doing a lot of research as well. A lot of research to learn more about coping skills and how to get things done. And there's so much information out there. So that's what I'm doing. I'm trying to find ways to get the things done that I need. And for me, this is going to sound boastful, but it's really not. It's just an explanation. Like I said, I've struggled with things like procrastination and difficulty getting things started for years. And that's just two of the things. Focus was such a problem. But I've been able to be quote unquote successful at work and, in teaching and all in my jobs and in school because of my intellect, if that makes sense. And that's not a boast thing. It's like, so my paper may be late, but when I do it, I'm going to get an A on it because of the quality of the work. But the thing about that is that it was so frustrating. So let me give you an example for like I said, I did my bachelor's, my master's, and this doctoral program that I'm in now. I did it all online. And so the courses are typically 8-week courses. So at the beginning of the course, I'm all gung-ho. I'm so excited about the course. I go in and I print out my syllabus and the course outline, and I make a schedule, I make a calendar, and I have everything on paper, and I just have this great plan. And I start out the first week, on time. It's, I do everything that I can think that is possible to get done in that first week, because what I learned is around week 3, I'm done. And I have no energy. I have no drive. It's like I just become totally disinterested, and I have to force myself. And there's a sense of shame and embarrassment. And why am I like this? Why can't I just do it? Why can't I just get it done? So I start out really well, and then I just fizzle, and I would be so frustrated. And, I would communicate with my instructors and say, whatever's going on. But so it's an 8-week class. So I may miss weeks 3 through potentially 6. But then that week 6, 7, and 8, or 7 and 8, I do all of that work like within a week. I turn in, and because the quality of the work is good, and my instructors have always been just graceful, full of grace. That's what I call them. I've been able to be successful, but I didn't want to keep doing that. But I didn't realize that there was a clinical condition. I never would have in a million years thought that I had ADHD. Never. But when I started doing research, I saw myself in black and white, and it was like a weight was lifted that, okay, it's not just you. And more importantly, we can address this now. So I want to encourage you all. I know that sometimes you all may feel like, being a nursing student, that you're the only one that's struggling with things, struggling with, I have to work, and I have to take care of my family, and I have to get all of this work done. And then any other personal, this having to work from home and just all of these changes in this year has been a struggle for everybody. So I want to encourage you all, it's stressful. But as we get through this, it will certainly be worth it. I'm reading your comments. Wow. One of the classes that I was in is health policy. And as I mentioned before, we had to create a health policy. Whereas in my previous courses, my previous programs, we would study health policy. So my policy was on mental health and mental illness, and making treatments much more readily available for a situation like Mike. Just making it readily available because people are struggling, not just physically, but mentally. So if I were to create a policy and submit it for, change, that's certainly something that I would I can't think of words this morning. So this COVID has messed up my brain. I can't think of words, but I think that's something that our country really, really needs to focus on. We have a lot of people that are struggling mentally. And that's why I think we have to be supportive of each other in any way that we can. We have to, again, like I said before, we have to show each other grace and compassion and be patient with each other so that we all can be successful. But, okay. I think we all probably have in some shape, form, or fashion. I ate too much in my younger days, and now I'm having to take not insulin, but medication. And I never thought that I would have to do all these things. But again, to find the positive in that, look at what you accomplished and look at the differences. This is one of the ways that I gauge my success. It's not on titles, it's not on degrees. When I see students graduate and I see students get licensed, that makes me feel successful. When students are struggling and I'm able to help with tutoring or something like that, and I see them improve on their work. So for me, making a difference in the lives of other people is sort of my measure of success, if that makes sense. And so to speak to Jamie's point, think about, how much you accomplished in the sense of what you do to help others. That's sort of how I see it. And so although we are probably all sort of reaping the the fruits of our our previous behavior, I try to minimize that, by thinking about like when I was actually practicing as a nurse and knowing that I did the very best that I could to make sure that I used what I learned to help the people who were in my care, or by reading, even when you're not in school, but to read articles and to read all of the million emails that come through your work about how we're changing this and all these things. Just, staying current on the latest evidence-based practice and just learning as much as I can about medicine and nursing practice and how to be the most proficient and efficient nurse that I can. I don't have to be the best nurse, but I want to say that I'm doing the best for my patients and the people that I'm caring for. And that involves being knowledgeable. Right now, my instructor, one of my instructors told me, Jamie made a statement here. I just wish what I read would stick. So one of the things that I've always done, especially when I started working on my master's in nursing education. So my focus was nursing education. And one of the things that I did was in each class, as I learned about a technique or whatever, as I learned something, I would apply it. And so during the summer, I had a class that was really difficult. It was healthcare finance and marketing. Who has never done any type of marketing? I knew nothing about marketing. So this was a brand new content and I was terrified. Okay. I felt like I knew absolutely nothing. And so having to learn all of this new content and with my personal habit of trying to apply what I've learned, it was really a struggle. And one of the things that my instructor said to me was, right now, you're just trying to get through the class. And so it's going to stick at a later time. So to speak to what you're saying, Jamie, I promise you, and I promise each one of you that are listening, you're not going to remember every single thing. That's why we tell you when you graduate, don't try to go back and relearn everything. It's a waste of your time. What's happening is what you're retaining it, but because it's so much, it's hard to say, it's hard to realize that you're retaining it. But I promise you, when you get in practice, especially, you'll recall little things. It may be like, for example, I don't know, but just hypothetically, you're working in an ER and where you're going to see, all levels of life. And, I don't know what the name of that was, but I remember something about it. And it's those types of things. And your NCLEX is not designed to try to find, again, it's like I mentioned before, the NCLEX is not going to try to find little specific, minute details to see if you remember it. That's not the goal. The NCLEX is designed there's major sort of categories, if that makes sense. That's why I said that, you tend to see these certain things, like CHF, heart failure. That's a major condition. And so you're probably going to see questions on heart failure. You may not see anything on tricuspid atresia because it's a lesser, not lesser, it's not as common, if that makes sense. It wants to know if you recognize concepts, just overall patient safety, medication therapy, things like that. But what you're going to see in practice, as well as on your NCLEX, is that the information is going to come back to you. It'll be there when you need it. That's what I'm trying to say. So what you're reading, I promise you, it's sticking. And it's just that you can't see it right now. It's like you all are in the eye of the storm. And I fully understand that and relate to it. You all are in the eye of the storm. But if you look at it, this is another way that I look at it. And I've said it before. If you look at this program, not just this program, but the Associates of Science and Nursing degree, look at how many, I would wager to say probably millions, but at least hundreds of thousands of people that have done it, right? And for the most part, they've had to endure the same types of things that you all, maybe not to the extent that the COVID crisis has created. But my point is, other people have done it, and there's absolutely no reason why you all can't. So you're going to do it. You're going to be successful. We are doing our level best to help you all as much. And I don't mean that like as far as the work, but I mean to take in consideration the struggles that you all, the situations that you all are facing, just like we are. So we're trying to be mindful of all of that. But I can say, you guys are doing, and overall in all of this, you all have had such great attitudes. That makes a world of difference. You all have had such great attitudes, and it's not a matter of you all, liking us or not liking us, or liking the content or not liking the content. I mean, just overall, just staying positive. Because I tell students frequently that when you take on this attitude of just focusing on the negative, that doesn't help you. It's not a matter of whether you like Miss Love or not. That's irrelevant. But when your focus becomes on the negative aspects, the things that you don't like, that hurts you because then you're not open to learning. So you all have had just great attitudes, and again, that benefits you. That benefits you all. It makes life a little easier for us, but it certainly benefits you all. You all have been a great cohort, and what you will see, one of my best friends, I met her in my LPN program in 1995, and she is still one of my best friends today. Yeah. All right. I don't want to just waste your time, everybody. Any questions, concerns, anything that we can address? Miss Gilbert is back. So is there anything that we can address in anything? It doesn't matter.
Miss Love.
Yes.
I'm sorry. Were you still gonna put up the template?
What template?
The template for the disorder. I mean, not the template. I'm sorry. Is this the nursing care? What it is? The plan of care.
I'm trying to remember what we're talking about. Was it something I said I was going to do? Oh, okay. See, that's another thing I learned.
Yes, I'm sorry. Yes, the question about.
Something else I learned about myself. I can remember all types of things, but it's little things that I forget. So if I don't write it down, I may forget it. And I think that's what happened. So if I say I'm going to do something and I don't do it, please charge it to my head and not my heart, because I will, the next minute, if something else comes up, I will forget about it. So I apologize. So I will write that down. And I've learned to take notes or to make notes to myself. So what I called it, it's a little bit different. The document that I was referring to is a little bit different from Ms. Gilbert's, in that she wants you all to, the concept map is a little bit different because you make connections, whereas what I was referring to was basically, I call it a pathophys map, and it's basically, again, like the system disorder the ATI provides. But I will provide a template for both of those. So I'll do that today. Thank you for reminding me, and I apologize if I forgot, sorry, that I forgot. Ms. Gilbert, do you want to add anything? I'm going to mute my mic unless there's another question for me, and make you presenter again.
No, I don't have anything additional, but a note on that concept mapping. My hope is that concept mapping, formulating those connections, but I know out of habit, it's going to be easy for you to make it like a system disorder with causes, symptoms, things like that, but try and branch them out a few. Make sure you're hitting those big points that's in those lectures. So something was talked about like chest physiotherapy, education to asthma client, put some specifics there, not just education. Education about what? So just making sure that those concepts are being brought across, so that my hope is that when reviewing your concept maps that I can be like, yes, this is a great study tool for you to do. But if I'm adding anything, please note on them, or I'll bring to your attention, but please note that those additions or major concepts that I'm thinking that are missing, I'm trying to bring to your attention before the exam. Okay, is my purpose for that.
Jamie asked about, asked if I would send a message or announcement, letting you all know where the location of my upload is. Jamie, I literally just learned that when we make a change in Canvas, there's a little box that says notify users of this change. I didn't know it was there. So I will do that. I just learned about that just recently. So anything that I add, as far as that upload, it will be in the week 14 content, but I will hit that box so that you all are informed of update. I didn't know that. That's a good question. And I apologize because I didn't realize that was an option before.
The topics list that was posted though is on its own at the front of the module. It's not in a weekly because it involves all 4 weeks.
Right. Have you all seen the topics list?
That I pulled up. So when you go to module 4, it should be the first thing in the module before the outcomes for week, was it 12 or 11? It's now there in front of the outcomes. And it's for the entire module. So it's not inside of a week page.
Okay. So that's all that I have. Any other questions, concerns for either of us? Ms. Gilbert, can you see the
Yes.
statement? Okay.
When I was grading someone's module 4 learning assignment, it did not post the grade when I was done. So for some reason, the column was hidden after grading was completed. So I had to post the grades. So it's just a thing in Canvas. And therefore, it sends an automatic message to everyone saying that grades and comments have been released for this assignment. But some of y'all haven't even submitted it. It's not late. There's no grade. There's no comment because there's nothing submitted. It was just the column that had to be released. And so it was an automatic message. So if you got that message and then you went and there's nothing there, it's because there's nothing there. It's just the column. Sorry.
Okay. Once again, so I figured out a reference. Oh, okay. What stated that a reference she was reading was incorrect about fetal circulation? Yeah, I was curious also. Which reference was that? Okay. All right. Anyone else? All right. Well, again, you all are doing great work. Keep it up. Keep up the great attitudes. You're putting in great efforts. You're going to be successful. We believe that. All right. I'm done, Ms. Gilbert, unless you have something else.
My firm belief is that everyone will be successful in this class. That is my hope and my goal. All right. When my internet gets back on, I will begin regrading or grading those project assignments. Y'all have a great day.
Have a great day, everyone.